inviting me to be part of this panel. I come from a bit of a different background. I work more broadly on the issues of open data and open access, so my talk is just going to be coming from that perspective. In particular, I'm going to be talking a little about the actions of data sharing and data reuse, and how scientists and laboratories around the world share, access, and reuse data that's available online. So engaging scientists in practice of data sharing is vital for the progress of global health research, and in particular genomics research, and is intimately connected with developing effective structures for data sharing, curation, and analysis. In this talk, I'm going to consider that current data sharing structures and initiatives aimed at promoting access to data require further examination if we are to facilitate the inclusion of developing country scientists into future research. Indeed, I'm going to suggest that many of the current approaches that may contribute towards the perpetuation of inequality in data reuse and the existence of data poverty amongst some communities of scientists in developing countries due to contextual issues of resource limitations. Now, in order to better explain this statement, it's necessary to first consider the way harms and benefits of data sharing are often presented. And this is something that understandably influences the way data sharing structures are designed. The rise of data sharing has, of course, been accompanied by the recognition of the problems associated with the distribution of benefits, the protection of rights, the dangers of commodification, and problems of access. In developing ways to mitigate these harms, issues of contextuality have taken into serious consideration and have become very important in how we conceptualize and implement the structures that mediate bioinformation economies. Particularly the problems of access have been taken very seriously for developing countries, and there has been considerable discussion about how best to enable scientists working in resource-limited environments to share in the data that are being accumulated online. And this has led to considerable efforts to develop initiatives that mitigate the financial and publication barriers that might affect researchers working in these low-resource environments. In addition, the recognition of these low-resource research environments has caused many bioinformation networks to offer data producers in developing countries extended moratoria on data publication. And this actually brings me to the point of my discussion. While these initiatives have been undeniably useful, they also potentially represent insidious challenges that need further investigation. So, why do I say this? What I propose is that the approaches reflect a specific perception on the benefits that may be accrued from data sharing. In particular, that providing access to data ensures that the possible benefits of data sharing may be realized by anyone. And this assumption rests on two important points. Firstly, that the available data are equally accessible for reuse to all who have access to it. And secondly, that the benefits derived from data sharing are indeed global in their distribution and of equal value in any geographic location. Thus, in contrast to more contextualized discussions on harms, when we talk about the benefits of data sharing, it is often largely assumed that ensuring equal access to data will ensure equal benefits to all who would reuse it. And therefore, the realization of benefits for scientists in developing countries is considered intimately linked to the need to increase access to data. It should be obvious, of course, to anyone who is involved in data reuse that realizing the benefits of online data requires so much more than simply having access. Being able to effectively reuse online data requires skill, training, resources, and a culture of support, as well as considerable financial resources and sustainable institutional and governmental support. And while these issues may be rather obvious, trying to frame them in a useful way is often quite difficult. So we have to ask, how do we talk about inequalities in terms of data sharing beyond these basic terms of data access? And in this, I propose that the capabilities approach of Amartya Sen is particularly helpful. Now, this theory was developed to discuss welfare economies, and thus I feel can be effectively adapted to talking about bioinformation economies as well. This approach emphasizes the presence of functional capabilities as a means of understanding poverty, and this represents a marked shift away from traditional ways of measuring inequality, such as utility or access to resources. Functional capabilities, in contrast, are the ability for an individual to realize their actions and to exploit the resources that are available to them. And this requires freedom, agency, and the ability to transform resources into valuable activities. And this is a schematic diagram of the capabilities approach. And basically, if we look at it in very basic terms, if you have a resource such as having a bicycle, it comes with certain functionings, such as being able to provide transport. However, the capability to transform that functioning into an action requires things like having access to proper roads or even having legs to use your bicycle. So therefore the utility of having a bicycle and the resource of having a bicycle do not necessarily match up exactly. Poverty is thus construed in terms of capability deprivation, and individuals can be deprived of capabilities in a number of different ways, including ignorance, government oppression, lack of financial resources, or indeed false consciousness. And what is important to remember about the capability approach is that the focus is not only on how human beings function, but also on their having the capability, which is a practical choice, to achieve the outcomes that they value and have reason to value. And in this way, it becomes both a global and a local theory. So, in a similar fashion, I think that the capabilities approach should challenge our understanding of scientific data for two important reasons. Firstly, it forces us to question whether scientists in developing countries have the capabilities to fully exploit the data resources that are increasingly becoming available. And secondly, it should make us wonder whether scientists in developing countries, when given the freedom to choose, will value the same outcomes or benefits of the data for the same reasons. And a corollary to this would be the question of whether the data that are being shared are useful enough for them to be able to achieve their desired research goals. In questioning whether scientists in developing countries can fully exploit the data that are available, necessitates that the idea of the digital divide between North and South be re-examined. And traditional discussions about the North and South have focused on the distinction between those that have and those that have not, in effect those that are online and offline. And this is reflected in the current initiatives that aim to increase the amount of data available to scientists working in developing countries. However, the capability to realize the functions of data reuse could be said to raise markedly different needs. Making use of online resources involves much more than having a computer or an internet connection. It involves a diverse range of other issues, varying from access to equipment, restrictions of autonomy to reuse this equipment, and the skills of the users involved. Other issues such as poor support for data sharing amongst peers and mentors, different cultures of data sharing, ingrained preferences of research styles, and ways in which research projects are structured could all hamper scientists when attempting to access and share and reuse data. And moreover, the underlying presence of cultural preferences in how data sharing modalities are constructed, how websites are structured, the languages that resources are available in, and even the algorithms that build the online environment could potentially alienate some scientists from fully engaging in the online resources. And what is even more concerning is the realization that even if scientists in developing countries are able to overcome some of these capability hurdles, it is possible that a large amount of data that are freely available online, and particularly health data, will not be of great use to them in their desired research projects. This may force them to shape their research agendas to fit the data that are available, or to risk being marginalized in an increasingly data-centric manner. And all these points make it very obvious that there are many barriers to the realization of functional capability in bioinformation economies, and that ensuring that data are available online may just be the tip of the iceberg when it comes to effectively overcoming the divide between the northern and the southern scientific communities. Indeed, it is possible that without careful consideration of these issues that the capability approach raises, we may create situations of data poverty within the scientific community, despite making provision for global access to the data. Models such as the capability approach, however, offer considerable food for thought and force us to focus on how best to engineer data sharing tools and practices. As we've heard throughout the day, some existing networks and collaborations, such as H3 Africa and MalariaGen, have taken these issues quite seriously and are engaging with issues of functional capability in their specific areas of interest. However, we need to expand that a little further and ask how these type of issues can be applied to all data sharing structures. Continued discussion on these issues will offset the problem of perpetuating data inequalities that exist between developing and developed countries, and ensure the inclusion of developing country scientists in the future of global health research.